Isaiah is outgoing, boisterous, stubborn, typically a fun person to be around. He was very fatigued. He had a fever, coughing. We initially went to the urgent care. They looked at him for 10 minutes and they decided that he needed to come to Williamson.
He was the sort of poster child for coronavirus. When he came to the hospital, he was placed on oxygen, and then within about 12 to 24 hours, his oxygen needs went way up.
I had no idea that it would progress the way it would.
Within 24 hours of him coming to the hospital, he was put on a ventilator. I heard his voice, and then the next time I heard his voice was almost 2 months later.
Isaiah was here for 53 days. We didn't know if he was going to leave.
When he first came in, he was very, very, very sick. Just laying in a bed and relying on us to take care of him, to turn him, to feed him, to bathe him, to comfort him. To watch somebody so young struggle was really hard for all of us. Moving him out of the COVID unit into the regular ICU was huge for us.
It was interesting to see him process kind of how sick he'd been and how long he'd been there.
Of all the things that he wanted during his 2-month hospitalization, he was desperate for a banana.
He wants his banana.
We were all so invested in his success.
Because we couldn't come up to be with him, they even used their personal devices to allow us to FaceTime when he got to a place where we could actually talk to him. It was great for us to have an opportunity to see him and to see that he did look like he was progressing.
We put so much work and heart and soul into him. You know, Isaiah became part of our family here at Williamson.
On the day he was going to be released, it was really cool to see everybody get the opportunity to say bye to him.
I just remember so many staff members surrounding him, and we had signs for him, and it was truly one of the best moments of my life.
To see him get to see his family again and hug his daughter and his partner and just the whole experience, it was really touching.
To the team, I would just like to say thank you. Thank you for loving him. Thank you for loving us and just caring enough about us. Nurses and doctors and people in the healthcare field do what they do because they want to help people. But this team has gone above and beyond anything that I could have ever imagined.